I'm Dr. Chetan Rao. I'm a professor of neurology, neurosurgery, and Center for Space Medicine at Baylor College of Medicine in Houston, Texas. The COMPOSE study is a study that is supported by the Curing Coma Campaign and is funded by the Neurocritical Care Foundation. COMPOSE is a prospective observational study that has three specific goals. Goal number one is to understand the phenotypic evolution of recovery from coma, how people recover from coma. And it is done in a very international base set, and we have about 31 to 35 international sites which are participating in this study. The second goal of this study was to establish a hub and spoke network of research, which we have been successfully able to do so with two core sites. One is at Baylor College of Medicine that helps in collection and organization of data and sites that are non-European. And the second core site is from the University of Milan Bicocca, headed by Dr. Giuseppe Citerio, which helps in coordinating all the data from European Union. And the third important objective of our study is to understand what is the variability of care that patients in coma experience across the world. And by collecting all these data from 31 to 35 international centers, what we plan to do is to identify factors that might be helpful in getting patients from recover from coma. This idea actually was an organic progression of what Curing Coma Campaign is doing. Having been a part of Curing Coma from its inception, it's important to listen to people who care for patients with coma, and also to gain the knowledge from all the experts who work in Curing Coma Campaign. And there were three specific objectives that Curing Coma had identified. One big gap in research is we don't have a patient-level data on phenotypic recovery from coma. And the second was we don't have a good network of research sites. And the third, obviously, is how do we get all the people who have the like mind of working together to help people recover from coma under one big umbrella, where we can bounce off ideas and then come up with a common language to identify patients who have different aspects of coma, and then how do we identify those individual factors that help them recover. So these three specific questions came out of Curing Coma Campaign. I was just very fortunate to be a part of that discussion, and I just took the charge on organizing these questions together, and then with the help of incredible support of friends and investigators, I was able to put this study together. And then thankfully, the Neurocritical Care Foundation found this particular scientific question that I was trying to ask very appealing to her to receive the funding. And that's how our journey got started. The lessons I've learned from doing the COMPOSE study is it's exciting, and it's very easy to work in a complicated yet large administratively overburdened study, especially when you're working with friends and like-minded people. It has been a very enjoyable experience working on the COMPOSE study. Having said that, what we have learned is the practice of caring for patients with coma is very different across the world. And then that is perhaps the single most component we received. Our mortality of patients in this particular study, the way we have defined coma, is about 60%. And then that's purely based on our definition of coma, which is the dose of coma we have decided as the steering committee was to have a motor score of Glasgow Coma Scale, 4 or less. And the duration of the coma was to have at least 72 hours of exposure to that particular level of injury to the brain. And so a combination of both, what we learned is that at least around 60% mortality across the patient population, which is shocking um, and surprising to us. And then the second component I learned from Compose study is the outcomes of patients who do survive are actually pretty good. And then obviously we are still evaluating the data. The preliminary observations has been that patients who do survive tend to recover well. And the recovery patterns are very different. They go beyond the traditional 72 hours waiting period that we use for, for example, cardiac injury to do prognostication. And once the data is out, my feeling is that our study will pave way for longer observational times for patients who have primary neurological injury before anybody makes an attempt towards neuroprognostication. I think we already are funded for a second study. It's called the Decipher Coma, which stands for Decoding Endotypes and Phenotypes in Recovery from Coma. And this was funded by the Spaulding Rehabilitational Institute. And that was possible because of our collaboration within the Compose network. And in this particular Decipher Coma study, we are asking two broad questions. Question number one is, can we identify autonomic nervous system reactivity as a biomarker for patients who recover from coma? And within that larger questions, we are asking two specific sub-questions. Sub-question number one is, can we use heart rate variability at baseline and during structured evaluation? And second one is respiratory rate variability at baseline and during structured evaluation as biomarkers for patients who may recover from coma. And the second larger question we are asking is, there are so many subcomponents of normal care that is documented in the electronic health record. Is there a way we can do a structured and an unstructured analysis of the electronic health records using some artificial intelligence platforms to identify, I would say, non-conventional biomarkers for patients who would recover from coma? So we are trying to use, in short, we are trying to use autonomic nervous system as endotype markers and electronic health records or hidden information in those electronic health records as a potential endotype markers for patients who will recover from coma. And this is the other exciting thing about Decipher Coma is it ties together two large functioning groups or research groups together in, I would say, Decipher Coma kind of merges two large research groups. One is our Compose network, followed by the NIH Bridge to AI Chorus network, led by Dr. Rosenthal in Mass General. And both these units coming together helps us in unlocking perhaps the new novel endotypes of coma recovery based on autonomic nervous system and some hidden features that are found in electronic health records. And I'm very excited to execute those two specific aims in our study. I think the Compose study is funded by the Neurocritical Care Foundation, but it is powered by collaboration. And then it would be amiss not to acknowledge all the steering committee members who have spent their invaluable time in structuring the study. I have to say thank you to Dr. Jose Suarez, Dr. Joe Giacchino, Dr. David Menon, and Dr. Abhijit Lele, Ms. Eusebia Cavillo, and Dr. Yelena Bodine as a part of the steering committee members. And that's one part of it. And it's not possible to enroll all these patients. This is a scarcely funded study, but it's the collaborative powers of all those 31 to 35 international collaborators, including Dr. Raymond Helbut, Dr. Giuseppe Citerio in Europe who are driving this, and our colleagues in Argentina, in Brazil, and in South Africa who have contributed, and then in the Middle East who've had undeniable contributions to this study. Every single family members, the patients, and the research coordinators who actually do all the brunt work at bedside in providing all this data. I'm incredibly thankful for all these people for making Compose very successful.